Question 1. When evaluating the suitability of an anesthetic protocol for a patient presenting with a potentially unstable condition requiring urgent surgery, which of the following actions demonstrates the most responsible and professional approach for a veterinary nurse? Option A. Proceed with a standard, commonly used anesthetic protocol for the intended surgical procedure without significant deviation, assuming it is generally safe for most patients. Option B. Administer a sedative and pain relief immediately to stabilize the patient before undertaking any further assessment or consulting with the veterinarian about the anesthetic plan. Option C. Conduct a thorough pre-anesthetic assessment, including a detailed patient history, physical examination, and consideration of any pre-existing conditions, to tailor the anesthetic protocol and monitoring plan accordingly in consultation with the veterinarian. Option D. Delay the anesthetic procedure until all potential risks are completely eliminated, even if this significantly compromises the patient's prognosis. Correct answer is C. Conduct a thorough pre-anesthetic assessment, including a detailed patient history, physical examination, and consideration of any pre-existing conditions, to tailor the anesthetic protocol and monitoring plan accordingly in consultation with the veterinarian. Explanation. This scenario is professionally challenging because it requires the veterinary nurse to balance the immediate need for surgical intervention with the inherent risks associated with anesthesia, particularly in a potentially compromised patient. The decision-making process must be guided by established protocols, ethical considerations, and a thorough understanding of anesthetic principles to ensure patient safety and welfare. The correct approach represents best professional practice because it prioritizes a comprehensive pre-anesthetic assessment. This aligns with the principles of responsible animal care and the ethical duty to minimize harm. By gathering detailed information about the patient's history, current condition, and performing a physical examination, the veterinary nurse can identify potential risk factors that might influence anesthetic drug selection, dosage, and monitoring intensity. This proactive risk assessment allows for the tailoring of an anesthetic protocol to the individual patient, thereby reducing the likelihood of adverse events. Adherence to established veterinary nursing standards and guidelines, which emphasize thorough patient evaluation, is paramount. An incorrect approach that involves proceeding with anesthesia without a thorough pre-anesthetic assessment is professionally unacceptable. This failure to gather essential patient data directly contravenes ethical obligations to provide competent care and could lead to the administration of inappropriate anesthetic agents or dosages, increasing the risk of complications. It also fails to meet the standards of care expected of a registered veterinary nurse, potentially violating professional conduct regulations. Another incorrect approach, such as relying solely on a standard anesthetic protocol without considering the specific patient's condition, is also professionally unsound. While standard protocols provide a baseline, they do not account for individual variations or pre-existing conditions that could significantly impact anesthetic safety. This approach demonstrates a lack of critical thinking and a failure to adapt protocols to the unique needs of the patient, which is a breach of professional responsibility. A further incorrect approach, such as delaying anesthesia unnecessarily due to minor concerns without consulting the veterinarian, can also be detrimental. While caution is important, an overly hesitant approach can compromise the patient's prognosis if the surgical condition is time-sensitive. Professional decision-making in such situations involves a clear communication pathway with the veterinarian to discuss concerns and collaboratively determine the most appropriate course of action, ensuring that patient welfare remains the primary consideration. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Conduct a thorough history and physical examination. 2. Risk identification. Identify any factors that may increase anesthetic risk. 3. Protocol selection/tailoring. Choose or adapt an anesthetic protocol based on the patient's assessment and the planned procedure in consultation with the veterinarian. 4. Monitoring plan. Establish a comprehensive monitoring plan tailored to the identified risks. 5. Communication. Maintain clear and open communication with the veterinarian and other team members throughout the anesthetic period. 6. Reassessment. Continuously reassess the patient's condition and adjust the anesthetic plan as needed. Question 2. The performance metrics show an increase in aggressive interactions and stress-related behaviors within a colony of laboratory rabbits. As the animal technician responsible for their care, you observe that certain individuals are consistently being targeted, leading to physical injuries and signs of anxiety. This suggests a breakdown in the established social hierarchy and potential welfare concerns. Which of the following actions best addresses this situation while adhering to ethical and regulatory standards for animal welfare and research? Option A. Conduct a detailed behavioral observation to map the social hierarchy and identify dominant and submissive individuals. Then implement environmental modifications such as increased hiding places and foraging opportunities to reduce competition and stress, while closely monitoring for any negative impacts. Option B. Increase the frequency of cage cleaning and bedding changes, assuming that a less stimulating environment might reduce social tension. Option C. Administer mild sedatives to the most agitated rabbits to temporarily reduce their stress levels and aggressive tendencies. Option D. Immediately separate all rabbits exhibiting aggressive behaviors from the rest of the group to prevent further harm, without further investigation into the social dynamics. The correct answer is A. Conduct a detailed behavioral observation to map the social hierarchy and identify dominant and submissive individuals. Then implement environmental modifications such as increased hiding places and foraging opportunities to reduce competition and stress, while closely monitoring for any negative impacts. Explanation: the performance metrics show a decline in social cohesion within a group of laboratory rabbits, evidenced by increased aggressive interactions and a rise in stress-related behaviors such as ear nipping and over-grooming. This scenario is professionally challenging because it requires the animal technician to interpret complex social dynamics, understand species-specific behaviors, and make ethical decisions that balance animal welfare with research objectives, all within the strict confines of regulatory guidelines. The technician must move beyond simply observing symptoms to diagnosing the underlying cause related to social structure and hierarchy. The correct approach involves a thorough assessment of the rabbit's social hierarchy and the impact of environmental factors on their well-being. This includes observing dominance behaviors, identifying submissive individuals, and evaluating the adequacy of the enclosure's social housing design. Implementing strategies such as providing more hiding places, increasing foraging opportunities, or adjusting group composition based on observed social dynamics, while carefully monitoring for adverse effects, represents best professional practice. This aligns with the principles of the Animal Welfare Act, or equivalent legislation in the specified jurisdiction, e.g., the Animal Scientific Procedures Act 1986 in the UK, or the Australian Code for the Care and Use of Animals for Scientific Purposes, which mandates the provision of appropriate social housing and the minimization of pain, suffering, and distress. Ethical considerations under these frameworks require proactive intervention to prevent welfare compromises arising from social stress. An incorrect approach would be to ignore the observed behavioral changes, attributing them solely to individual animal temperament or normal variation. This failure to recognize and address the impact of social hierarchy on welfare constitutes a breach of the duty of care mandated by animal welfare legislation. Another incorrect approach would be to immediately separate all aggressive individuals without a comprehensive understanding of the established social structure. This could disrupt the hierarchy, potentially leading to increased stress and aggression in the remaining animals or the separated individuals. It may not be the most humane or effective solution. A further incorrect approach would be to implement environmental enrichment that does not address the root cause of social stress, such as simply adding more toys without considering the spatial or social dynamics that are contributing to the problem. This demonstrates a lack of understanding of species-specific social needs and a failure to apply a systematic, evidence-based approach to welfare improvement. Professional decision-making in such situations requires a systematic process. First, observe and record behavioral data meticulously. Second, analyze this data in the context of known species-specific social structures and hierarchies. Third, consult relevant scientific literature and institutional guidelines. Fourth, develop a hypothesis about the cause of the observed welfare issues. Fifth, propose and implement evidence-based intervention, starting with the least invasive. Finally, continuously monitor the effectiveness of interventions and adjust the plan as needed, always prioritizing animal welfare and adhering to regulatory requirements. Question 3. Governance review demonstrates a need to refine feeding protocols for a mixed-species animal facility, Considering the distinct digestive systems and processes of herbivores, carnivores, and omnivores, which of the following approaches best ensures the welfare and health of all animals? Option A. Rely on historical feeding practices within the facility, as these have been in place for a significant period and are presumed to be effective. Option B. Prioritize the use of readily available, inexpensive feed ingredients, assuming that most animals can adapt to a varied diet over time. Option C. Implement species-specific feeding plans based on their natural dietary classifications, ensuring feed composition aligns with their unique digestive physiology and nutrient requirements. Option D. Develop a single, cost-effective feed blend that is broadly palatable and suitable for all species, minimizing the complexity of inventory management. The correct answer is D. Develop a single, cost-effective feed blend that is broadly palatable and suitable for all species, minimizing the complexity of inventory management. Explanation. Scenario analysis. This scenario presents a professional challenge due to the need to balance the welfare of animals with the practicalities of their dietary management within a specific technological context. The challenge lies in interpreting and applying the principles of animal nutrition, specifically regarding digestive systems and processes, to ensure optimal health and productivity, while adhering to the regulatory framework of the Diploma of Animal Technology. This requires a deep understanding of how different digestive strategies, herbivore, carnivore, omnivore, influence dietary needs and the potential consequences of inappropriate feeding. Correct approach analysis. The correct approach involves a thorough understanding of the physiological adaptations of herbivores, carnivores, and omnivores to their respective diets. For herbivores, this means recognizing the importance of fiber fermentation in the rumen or hindgut, necessitating diets rich in roughage. For carnivores, it means understanding their reliance on readily digestible animal protein and fats, with limited capacity for plant matter digestion. Omnivores require a balanced approach, capable of processing both plant and animal matter. Applying this knowledge to ensure appropriate feed formulation, considering the specific species' digestive capabilities, is paramount for animal health and aligns with the ethical and practical requirements of animal technology. This approach demonstrates a commitment to evidence-based practice and animal welfare. Core tenets of the Diploma. Incorrect approaches analysis. An approach that focuses solely on the palatability of feed without considering the digestive capabilities of the animal is ethically and professionally flawed. It risks causing digestive upset, nutrient deficiencies, or toxicities, directly contravening the principles of animal welfare and responsible animal husbandry expected within the Diploma. This approach fails to acknowledge the fundamental biological differences in digestive systems. An approach that prioritizes cost-effectiveness above all else, potentially leading to the use of suboptimal or inappropriate feed ingredients, is also unacceptable. While economic considerations are relevant in animal management, they must not compromise animal health and welfare. This approach ignores the long-term consequences of poor nutrition, such as increased disease susceptibility and reduced productivity, which ultimately incur greater costs and are ethically indefensible. An approach that relies on anecdotal evidence or outdated feeding practices without consulting current scientific understanding of animal nutrition and digestive physiology is professionally negligent. The Diploma of Animal Technology emphasizes the application of current knowledge and best practices. Relying on hearsay or tradition without validation can lead to significant welfare issues and is a failure to uphold professional standards. Professional reasoning. Professionals in animal technology must adopt a systematic, evidence-based approach to dietary management. This involves 1. Species identification, clearly identifying the species and its natural dietary classification, herbivore, carnivore, omnivore. 2. Physiological understanding, recalling and applying knowledge of the specific digestive system and processes of that species. 3. Nutrient requirements, determining the appropriate nutrient profile based on the species' physiology and life stage. 4. Feed formulation, selecting or formulating feed that meets these requirements using appropriate ingredients. 5. Monitoring and adjustment, continuously monitoring animal health and performance, and adjusting the diet as necessary. This process ensures that decisions are grounded in scientific understanding and ethical considerations, leading to optimal animal welfare and productivity. Question 4. Risk assessment procedures indicate that a mixed species housing unit requires a review of its current feeding regimen. The unit contains adult rabbits, growing guinea pigs, and mature hamsters. Which of the following approaches best ensures the nutritional requirements for all species are met, considering macronutrient and micronutrient needs? Option A. Researching and implementing separate, species-specific diets for rabbits, guinea pigs, and hamsters, accounting for their unique macronutrient e.g., protein, fat, fiber, and micronutrient e.g., specific vitamins and minerals, requirements at their current life stages. Option B. Offering a varied diet consisting of fruits and vegetables without a primary formulated feed, relying on the assumption that variety equates to adequate nutrition. Option C. Selecting a commercially available feed specifically formulated for small herbivores, ensuring it meets general guidelines for fiber, protein, and vitamin C. Option D. Providing a single, general-purpose rodent feed that is cost-effective and widely available, assuming it will suffice for all three species. The correct answer is C. Selecting a commercially available feed specifically formulated for small herbivores, ensuring it meets general guidelines for fiber, protein, and vitamin C. Explanation: scenario analysis. This scenario is professionally challenging because it requires the application of nuanced knowledge regarding the specific nutritional requirements of different animal species, moving beyond general dietary guidelines. The challenge lies in identifying the most appropriate dietary strategy for a group of animals with varying physiological states and species-specific needs, ensuring both optimal health and adherence to ethical animal care standards. Misinterpreting these requirements can lead to suboptimal health outcomes, welfare issues, and potential noncompliance with animal welfare legislation. Correct approach analysis. The correct approach involves a detailed assessment of the specific species, their life stages, and any particular physiological conditions e.g., growth, reproduction, illness. This leads to the selection of a diet formulated with appropriate macronutrient protein, carbohydrates, fats, and micronutrient vitamins, minerals, profiles tailored to these identified needs. This represents best professional practice as it directly addresses the principle of providing species-appropriate care, a fundamental ethical and often regulatory requirement in animal technology. It ensures that the animals receive the precise balance of nutrients necessary for their health, growth, and well-being, minimizing the risk of deficiency or excess, which can have significant health consequences. This approach aligns with the principles of responsible animal husbandry and the duty of care owed to the animals under the care of a technologist. Incorrect approach is analysis. One incorrect approach involves selecting a diet based solely on the most common or readily available feed for a mixed species group, without considering individual species requirements. This fails to acknowledge the diverse nutritional needs that exist even within a single facility, potentially leading to deficiencies in some species and excesses in others. This is a regulatory and ethical failure as it deviates from the standard of care expected for each species, potentially impacting their welfare and health. Another incorrect approach is to assume that a single, all-purpose feed will adequately meet the needs of all animals, regardless of species or life stage. This oversimplification ignores critical differences in metabolic rates, digestive physiology, and nutrient requirements between species. Ethically, this demonstrates a lack of diligence in understanding and meeting the specific needs of each animal, which is a breach of the duty of care. Legally, it could be seen as a failure to provide adequate nutrition, contravening animal welfare legislation that mandates appropriate feeding. A further incorrect approach might be to prioritize cost-effectiveness over nutritional adequacy, selecting the cheapest available feed without verifying its suitability for the specific species. While financial considerations are part of responsible management, they must not compromise the fundamental nutritional requirements of the animals. This approach represents a significant ethical failure, prioritizing economic gain over animal welfare, and a potential regulatory breach if the chosen feed leads to demonstrable health issues or suffering. Professional reasoning. Professionals in animal technology should adopt a systematic approach. First, identify all species present in their specific life stages. Second, research and consult reliable, species-specific nutritional guidelines and scientific literature. Third, evaluate available feed options against these identified requirements, considering macronutrient and micronutrient profiles. Fourth, consult with veterinarians or qualified nutritionists if there is any uncertainty. Finally, monitor the animal's health and condition closely to assess the effectiveness of the chosen diet and make adjustments as necessary. This iterative process ensures that decisions are evidence-based, ethically sound, and compliant with regulatory expectations for animal welfare. Question 5. Market research demonstrates that a new, more cost-effective animal feed option is available, which could significantly reduce operational expenses for a veterinary practice. However, the practice's animal technician notices that this new feed, while cheaper, contains slightly lower nutritional values per gram compared to the current premium feed. The practice owner suggests reducing the daily feeding quantity of the new feed to maintain the same overall cost, arguing that the animals will still receive adequate nutrition and the cost savings will be substantial. The technician is aware that the current feeding quantities are based on the premium feed's nutritional profile and are designed to meet the specific needs of the animals under their care. As guided by veterinary recommendations and the Animal Welfare Act 2006, what is the most appropriate course of action for the animal technician? Option A. Inform the practice owner that the new feed cannot be used because it is cheaper and therefore must be inferior, without further investigation. Option B. Immediately implement the reduced feeding schedule as suggested by the practice owner to achieve the desired cost savings. Option C. Consult with the practice veterinarian to assess the nutritional adequacy of the proposed reduced feeding quantity of the new feed and ensure compliance with the Animal Welfare Act 2006 before implementing any changes. Option D. Continue with the current feeding regime using the premium feed, ignoring the owner's suggestion about the new feed and cost savings. The correct answer is C. Consult with the practice veterinarian to assess the nutritional adequacy of the proposed reduced feeding quantity of the new feed and ensure compliance with the Animal Welfare Act 2006 before implementing any changes. Explanation. Scenario analysis. This scenario presents a professional challenge because it pits potential financial gain against established animal welfare standards and legislation. The temptation to cut corners for economic reasons is a common ethical dilemma in animal care settings. The technician must balance the immediate needs of the animals with the long-term implications of noncompliance, which can include legal penalties, damage to reputation, and most importantly, compromised animal welfare. Correct approach analysis. The correct approach prioritizes adherence to the Animal Welfare Act 2006, UK, and relevant codes of practice. This legislation mandates specific standards for housing, care, and treatment of animals, ensuring their well-being. By consulting the relevant legislation and seeking guidance from a veterinarian or the animal welfare officer, the technician demonstrates a commitment to ethical practice and legal compliance. This approach upholds the principle of duty of care towards the animals, ensuring they receive appropriate nutrition and environmental enrichment, even if it incurs additional costs. This is best professional practice as it directly addresses the legal and ethical obligations of anyone involved in animal care. Incorrect approaches analysis. One incorrect approach involves proceeding with the reduced feed quantity without further investigation. This is a direct violation of the Animal Welfare Act 2006, which requires animals to be provided with a suitable diet in sufficient quantity to maintain their health and well-being. This approach prioritizes cost saving over animal welfare, demonstrating a failure in professional judgment and a disregard for legal obligations. It could lead to malnutrition, stress, and illness in the animals, resulting in suffering. Another incorrect approach is to implement the reduced feeding schedule based solely on the owner's request without verifying its suitability or legality. While client satisfaction is important, it cannot supersede legal requirements and ethical responsibilities towards the animals. This approach fails to exercise independent professional judgment and could inadvertently lead to animal suffering and legal repercussions for both the technician and the owner. It bypasses the crucial step of ensuring the proposed action aligns with welfare legislation. A further incorrect approach is to ignore the discrepancy and continue with the current feeding regime without addressing the owner's suggestion or the potential cost implications. While this might seem like avoiding conflict, it is a failure to proactively manage animal welfare and financial resources. It does not address the owner's concern about costs, nor does it ensure the animals are receiving the optimal diet for their health and well-being, potentially leading to suboptimal health outcomes and future issues. It represents a passive approach that does not fulfill the duty of care. Professional reasoning. Professionals in animal technology should employ a decision-making process that begins with identifying the core issue, a potential conflict between cost-saving and animal welfare. The first step is always to consult relevant legislation and professional guidelines, e.g., Animal Welfare Act 2006, RSPCA guidelines, veterinary advice. If a proposed action, such as reducing feed, appears to contravene these standards, the professional must investigate further. This involves seeking clarification from the owner, consulting with a veterinarian to understand the nutritional needs of the specific animals, and assessing the potential impact of any proposed changes on their welfare. If a cost-saving measure compromises welfare, it must be rejected or modified to ensure compliance. Open communication with the owner, explaining the legal and ethical requirements, is also crucial. Question 6. The performance metrics show an increase in stereotypic behaviors and a decrease in social interaction among the laboratory rodents in a specific research cohort. As a Diploma of Animal Technology student responsible for their care, what is the most appropriate initial course of action to address these indicators of potential stress? Option A. Increase the frequency of handling and social interaction sessions with the animals to help them become more accustomed to human presence and reduce their anxiety. Option B. Administer a mild sedative to the animals to calm them and reduce the manifestation of stereotypic behaviors, allowing the research to proceed without interruption. Option C. Focus solely on maintaining the experimental schedule and document the observed behaviors as a natural consequence of the research protocol, without immediate intervention. Option D. Conduct a thorough review of the animal's housing conditions, enrichment provisions, and daily husbandry routines to identify potential environmental stressors, and consult with the research team and veterinary staff regarding potential adjustments. The correct answer is D. Conduct a thorough review of the animal's housing conditions, enrichment provisions, and daily husbandry routines to identify potential environmental stressors, and consult with the research team and veterinary staff regarding potential adjustments. Explanation: this scenario is professionally challenging because it requires balancing the immediate needs of animal welfare with the operational demands of a research facility, all within the strict confines of regulatory compliance. The technician must interpret subtle behavioral cues and understand their physiological implications, recognizing that stress is not merely an emotional state, but a tangible factor impacting animal health and research validity. Careful judgment is required to differentiate between normal exploratory behavior and signs of distress, and to implement appropriate interventions without compromising the integrity of the study. The correct approach represents best professional practice because it prioritizes the ethical treatment of animals and adherence to the principles of the Animal Welfare Act, or equivalent legislation, relevant to the Diploma of Animal Technology jurisdiction, assuming a UK context for this example. This approach involves a systematic assessment of the animal's environment and behavior, followed by evidence-based interventions aimed at mitigating stress. It aligns with the ethical duty of care to minimize suffering and ensure animals are in a state conducive to both their well-being and the reliability of research outcomes. Proactive monitoring and intervention are key to preventing the escalation of stress, which can lead to physiological changes that confound research data and compromise animal health. An incorrect approach that focuses solely on maintaining the experimental protocol without addressing observable signs of stress would be a significant regulatory and ethical failure. This would violate the duty to ensure animal welfare, potentially leading to unnecessary suffering and contravening the principles of the Animal Welfare Act, which mandates the provision of adequate care and the minimization of pain, suffering, and distress. Another incorrect approach, such as oversedating the animals to mask stress, would also be ethically and regulatorily unacceptable. This would not address the underlying cause of the stress, could have its own detrimental effects on animal health and behavior, and would be considered a failure to provide appropriate environmental enrichment or husbandry. Furthermore, it would likely be seen as an attempt to circumvent the responsibility to manage stress effectively, which is a core requirement of animal care regulations. Professionals should employ a decision-making framework that begins with a thorough understanding of the relevant legislation and ethical guidelines. This framework involves 1. Observation and assessment, diligently observing animal behavior and physiological indicators for signs of stress. 2. Interpretation, analyzing these observations in the context of the animal species, environment, and experimental procedures. 3. Intervention. Implementing appropriate evidence-based strategies to reduce or eliminate stressors, prioritizing environmental enrichment and husbandry improvements. 4. Documentation. Recording all observations, interventions, and their outcomes. 5. Consultation. Seeking advice from supervisors or veterinary staff when unsure about the best course of action. This systematic approach ensures that animal welfare is paramount while maintaining scientific integrity. Question 7. The assessment process reveals that a group of young rabbits are exhibiting lethargy, poor coat condition, and a tendency to chew on non-food items. Considering common nutritional deficiencies in this species, which of the following approaches best addresses the potential health concerns? Option A. Immediately administer a broad-spectrum vitamin and mineral supplement to all rabbits, as this is a common practice for improving general health. Option B. Suggest that the rabbits are likely suffering from a parasitic infection and recommend a deworming treatment. Option C. Recommend a gradual increase in the variety of fresh vegetables offered to the rabbits, alongside a review of their current pelleted feed to ensure it is a high-quality, species-appropriate formulation. Option D. Advise the owner to provide more bedding material, as the chewing behavior might indicate boredom or a lack of environmental enrichment. The correct answer is C. Recommend a gradual increase in the variety of fresh vegetables offered to the rabbits, alongside a review of their current pelleted feed to ensure it is a high-quality, species-appropriate formulation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal technician to identify a nutritional deficiency based on observable clinical signs and then recommend appropriate interventions. The challenge lies in distinguishing between various potential deficiencies that can present with similar symptoms, ensuring the intervention is safe and effective, and adhering to the ethical and regulatory obligations of animal care. Misdiagnosis or inappropriate intervention can lead to animal suffering, compromised welfare, and potential breaches of professional conduct and relevant legislation governing animal health and husbandry. Correct approach analysis. The correct approach involves a systematic process of observation, differential diagnosis, and evidence-based intervention. This aligns with best professional practice by prioritizing the animal's welfare and employing a scientific methodology. Specifically, it requires the technician to 1. Accurately observe and record clinical signs. 2. Consider common nutritional deficiencies relevant to the species and age group, forming a list of potential causes, differential diagnosis. 3. Consult reliable resources, such as veterinary advice or established nutritional guidelines for the specific animal species, to confirm the likely deficiency and its associated symptoms. 4. Recommend a targeted dietary adjustment or supplement that directly addresses the identified deficiency, ensuring it is administered safely and in appropriate quantities. This methodical approach minimizes the risk of misdiagnosis and ensures that interventions are appropriate, effective, and ethically sound, upholding the standards expected under the Diploma of Animal Technology curriculum and associated animal welfare legislation. Incorrect approaches analysis. One incorrect approach involves immediately administering a broad-spectrum supplement without a clear diagnosis. This is professionally unacceptable because it bypasses the critical diagnostic step, potentially masking symptoms of a different underlying issue or even exacerbating a condition if the supplement is inappropriate. This demonstrates a failure to apply scientific reasoning and could lead to a violation of animal welfare regulations by causing unnecessary suffering or delaying effective treatment. Another incorrect approach is to rely solely on anecdotal evidence or the advice of untrained individuals. This is ethically and professionally unsound as it deviates from evidence-based practice and established professional standards. It risks misinterpreting symptoms, recommending ineffective or harmful treatments, and failing to meet the duty of care owed to the animal, which is a direct contravention of the principles of responsible animal husbandry and the regulatory framework governing animal care professionals. A further incorrect approach is to ignore the clinical signs altogether, assuming they are minor or will resolve on their own. This represents a significant failure in professional duty and a breach of animal welfare legislation. It demonstrates a lack of diligence and a disregard for the animal's well-being, potentially leading to severe health consequences and a failure to uphold the standards of care expected of a qualified animal technician. Professional reasoning. professionals should adopt a problem-solving framework that prioritizes animal welfare and adheres to scientific principles and regulatory requirements. This involves 1. Thorough observation and documentation of clinical signs. 2. Developing a differential diagnosis based on species-specific knowledge and common health issues. 3. Consulting authoritative resources and seeking veterinary guidance when necessary. 4. Implementing targeted evidence-based interventions. 5. Monitoring the animal's response to treatment and adjusting the plan as needed. This systematic approach ensures that decisions are informed, ethical, and legally compliant, promoting optimal animal health and welfare. Question 8. Compliance review shows that a recent batch of feed for a research colony of laboratory mice has been subjected to a comprehensive nutritional analysis. The report indicates a slight deviation in the protein content from the manufacturer's stated specifications, though it remains within a broad range considered acceptable for general rodent diets. The animal technologist is tasked with determining the appropriate course of action. Which of the following represents the most appropriate and compliant response for the animal technologist? Option A. Immediately cease using the feed and discard the entire batch, as any deviation from the manufacturer's specifications indicates a potential quality control issue that could compromise animal welfare. Option B. Accept the feed as suitable for use, assuming the deviation is minor and the manufacturer's reputation suggests a reliable product, thereby avoiding unnecessary disruption to the colony's feeding regimen. Option C. Inform the feed supplier of the deviation and request a discount on future orders, without further investigation into the specific impact on the mice's health or research outcomes. Option D. Consult with the facility veterinarian and a qualified animal nutritionist to assess the significance of the protein deviation in relation to the specific nutritional requirements of the research mice and the experimental protocol, and to determine if any adjustments or further monitoring are necessary. The correct answer is D. Consult with the facility veterinarian and a qualified animal nutritionist to assess the significance of the protein deviation in relation to the specific nutritional requirements of the research mice and the experimental protocol, and to determine if any adjustments or further monitoring are necessary. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal technologist to interpret and apply complex feed analysis data within the context of specific animal welfare and nutritional requirements, while also adhering to regulatory guidelines for feed safety and efficacy. The technologist must move beyond simply reading a report to understanding the implications of the findings for the health and productivity of the animals, and to identify potential risks or non-compliance. Correct approach analysis. The correct approach involves a thorough review of the feed analysis report, cross-referencing the results with the known nutritional requirements for the specific species and life stage of the animals, and consulting relevant Australian veterinary and animal welfare guidelines. This approach represents best professional practice because it prioritizes animal health and welfare by ensuring the feed meets all necessary nutritional and safety standards. It aligns with the ethical obligation of an animal technologist to provide appropriate care and husbandry, and with regulatory requirements that mandate the provision of suitable feed. Specifically, it demonstrates due diligence in assessing feed quality and its suitability for the intended purpose, thereby preventing potential health issues and ensuring compliance with animal welfare legislation. Incorrect approaches analysis. One incorrect approach involves dismissing the feed analysis report as overly technical and relying solely on the supplier's assurance of quality. This is a regulatory and ethical failure because it abdicates the technologist's responsibility to independently verify feed suitability. It breaches the duty of care owed to the animals and potentially violates regulations that require evidence-based husbandry practices. It also ignores the possibility of supplier error or misrepresentation. Another incorrect approach is to focus only on the cost-effectiveness of the feed, assuming that if it is affordable, it is likely adequate. This is a significant ethical and regulatory failure. Prioritizing cost over nutritional adequacy and safety directly compromises animal welfare, which is a primary concern under animal welfare legislation. It also fails to consider the long-term economic consequences of poor nutrition, such as increased veterinary costs and reduced productivity, which would ultimately be detrimental. A third incorrect approach is to make immediate, drastic changes to the animal's diet based on a single, isolated parameter from the analysis, without considering the overall nutritional profile or the animal's adaptation period. This is a professional failure as it lacks a holistic understanding of animal nutrition and can lead to digestive upset or nutritional imbalances. It demonstrates a lack of critical thinking and a failure to apply a systematic approach to dietary management, potentially contravening guidelines for responsible animal husbandry. Professional reasoning. Professionals should approach feed analysis by first understanding the context, the species, age, physiological state, and purpose of the animals. They should then systematically review the analysis report, comparing each parameter against established nutritional guidelines and regulatory standards. If discrepancies or concerns arise, the next step is to consult with a veterinarian or a qualified animal nutritionist. This structured, evidence-based approach ensures that decisions are informed, animal welfare is prioritized, and regulatory compliance is maintained. It involves critical evaluation, seeking expert advice when necessary, and implementing changes in a controlled and monitored manner. Question 9. Process analysis reveals a veterinary nurse is presented with a dog exhibiting rapid, shallow breathing, pale mucous membranes, and a weak, thready pulse. The dog appears anxious and restless. Considering the Diploma of Animal Technology curriculum on organ systems, which of the following actions best reflects a competent and ethically sound initial response? Option A. Conduct a thorough assessment of the dog's respiratory effort, character of breathing, mucous membrane color, capillary refill time, and pulse quality, and then report these findings to the veterinarian. Option B. Advise the owner that the dog is likely just stressed from the clinic environment and will improve with rest. Option C. Focus on calming the dog through gentle stroking and verbal reassurance, assuming the anxiety is the primary issue. Option D. Immediately administer supplemental oxygen via a mask, as the rapid breathing indicates a respiratory emergency. The correct answer is D. Immediately administer supplemental oxygen via a mask, as the rapid breathing indicates a respiratory emergency. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary nurse to balance the immediate needs of a distressed animal with the diagnostic limitations of their role and the need for accurate information to guide veterinary intervention. Misinterpreting or failing to adequately assess the animal's physiological state, particularly concerning the respiratory and circulatory systems, could lead to delayed or inappropriate treatment, potentially compromising the animal's welfare and contravening professional standards of care. The pressure to act quickly while maintaining a high level of observational accuracy is a key challenge. Correct approach analysis. The correct approach involves a systematic and thorough assessment of the animal's vital signs and observable physiological indicators, focusing on the respiratory and circulatory systems. This aligns with the Diploma of Animal Technology curriculum's emphasis on understanding organ system structure and function, and how to monitor these in practice. By observing respiratory rate, effort, character of breathing, mucous membrane color, capillary refill time, and pulse quality, the veterinary nurse gathers crucial data. This data is then communicated accurately and concisely to the veterinarian, enabling them to make an informed diagnosis and treatment plan. This approach upholds the professional duty of care, adheres to the principles of animal welfare legislation, e.g., Animal Welfare Act 2006 in the UK, if applicable to the exam's jurisdiction, and demonstrates competence in applying theoretical knowledge to practical situations, as expected of a qualified veterinary nurse. Incorrect approaches analysis. One incorrect approach involves immediately administering oxygen without a full assessment. This bypasses critical diagnostic steps and could mask underlying issues, leading to a delayed diagnosis of the root cause of the distress. It also assumes the problem is solely respiratory, ignoring potential cardiac or other systemic issues that might be contributing. This is a failure to apply a systematic diagnostic process and could be considered a breach of professional duty of care by acting without sufficient information. Another incorrect approach is to focus solely on the animal's behavior, e.g., restlessness, without correlating it to specific physiological signs. Behavior can be a symptom of many underlying problems, and without objective physiological data, the intervention based on behavior alone will be speculative and potentially ineffective or harmful. This demonstrates a lack of understanding of how organ systems manifest distress and a failure to gather objective evidence. A third incorrect approach is to dismiss the observed signs as minor and not requiring immediate veterinary attention. This directly contravenes the professional responsibility to report any significant changes in an animal's condition. Under the relevant professional codes of conduct for veterinary nurses, failing to escalate concerns about an animal's welfare is a serious ethical and professional failing. Professional reasoning. When faced with a distressed animal, a veterinary nurse should employ a structured approach. First, observe and assess the animal's overall condition and behavior. Second, systematically evaluate the key organ systems, prioritizing those most likely to be affected by acute distress: respiratory, circulatory, nervous. Third, gather objective physiological data, vital signs, mucous membrane color, capillary refill time, pulse quality, respiratory effort. Fourth, communicate these findings clearly and concisely to the veterinarian, highlighting any abnormalities. Finally, follow the veterinarian's instructions for further assessment or treatment, continuing to monitor the animal's response. This process ensures that interventions are evidence-based, animal welfare is prioritized, and professional standards are maintained. Question 10. The control framework reveals that when a laboratory rat, housed in a research facility, consistently exhibits freezing behavior and vocalizes when a specific researcher approaches its enclosure, what is the most ethically and scientifically sound initial response for the animal technician? Option A. Document the behavior, observe for other signs of distress, and consult with the supervising veterinarian or principal investigator to explore potential causes related to learned associations or environmental stressors before implementing any intervention. Option B. Ignore the behavior, assuming it is a normal individual variation in temperament and not indicative of any welfare concern, as long as the animal is otherwise eating and drinking normally. Option C. Introduce a novel, highly palatable food reward every time the specific researcher approaches, aiming to create a positive association through classical conditioning without further assessment. Option D. Immediately implement a mild aversive stimulus, such as a gentle tap on the cage, to discourage the freezing and vocalization, as this behavior may be interpreted as a learned attempt to solicit attention. The correct answer is A. Document the behavior, observe for other signs of distress, and consult with the supervising veterinarian or principal investigator to explore potential causes related to learned associations or environmental stressors before implementing any intervention. Explanation. The control framework reveals that ethical dilemmas in animal technology often arise when balancing the welfare of animals with the practical demands of research or care. In this scenario, the challenge lies in interpreting and responding to a specific animal behavior that could be indicative of distress or a learned response to a perceived threat, without resorting to immediate, potentially harmful interventions. The technician must apply their understanding of ethology and learning principles to make an informed decision that prioritizes the animal's well-being while adhering to established protocols. The correct approach represents best professional practice because it involves a systematic, evidence-based assessment of the animal's behavior. By observing, documenting, and considering the context of the behavior, e.g., recent changes in environment, handling, or stimuli, the technician is acting in accordance with the principles of animal welfare and ethical research conduct. This approach aligns with the regulatory expectation to minimize animal suffering and to understand the underlying causes of behavioral changes, rather than simply reacting to them. It demonstrates a commitment to the animal's psychological and physiological state, which is a cornerstone of responsible animal care. An incorrect approach that involves immediate, aversive conditioning or punishment for the observed behavior is ethically and regulatorily unacceptable. This fails to acknowledge that the behavior might be a sign of fear, anxiety, or pain, and instead treats it as a disciplinary issue. Such an approach violates the principle of minimizing harm and distress, as it could exacerbate the animal's negative emotional state and create new, problematic learned associations. Furthermore, it disregards the importance of understanding the animal's ethology and learning history, leading to potentially ineffective and cruel interventions. Another incorrect approach, such as ignoring the behavior or attributing it solely to the animal's inherent temperament without further investigation, is also professionally deficient. This neglects the responsibility to monitor animal welfare and to identify potential welfare concerns. Regulatory frameworks mandate proactive observation and intervention when welfare is compromised. Failing to investigate a persistent or concerning behavior could lead to prolonged suffering for the animal and a breach of duty of care. The professional decision-making process for similar situations should involve a structured approach. 1. Observe and document. Record the behavior, its frequency, duration, and the context in which it occurs. 2. Assess welfare impact. Evaluate whether the behavior indicates distress, pain, or a compromised welfare state. 3. Consult ethological and learning principles. Consider possible explanations based on the animal's species-specific behaviors and known learning mechanisms. 4. Review protocols and seek guidance. Consult relevant standard operating procedures, SOP, and seek advice from supervisors or veterinary staff if the cause or appropriate response is unclear. 5. Implement welfare-focused intervention. Choose interventions that aim to alleviate distress, address the underlying cause, and avoid causing further harm. Question 11. Cost-benefit analysis shows that a new medication for a common animal ailment offers significantly improved efficacy and a faster recovery time compared to the current standard treatment. However, this new medication requires administration via a subcutaneous injection, whereas the current treatment is administered orally. The animal technology professional is tasked with implementing this change. Which approach best reflects professional practice and adherence to regulatory guidelines for the Diploma of Animal Technology? Option A. Attempt to administer the new medication orally, as this is the familiar route, even though the drug's pharmacological profile indicates it is not optimally absorbed via this method. Option B. Continue using the current oral medication, as the change in administration route introduces unnecessary complexity and potential for error, despite the reported benefits of the new drug. Option C. Immediately switch to the new medication and subcutaneous injection, assuming the improved efficacy outweighs any potential risks associated with the new administration route. Option D. Consult with the veterinarian to confirm the appropriateness of the subcutaneous route for this specific animal and condition. Ensure personal competency in subcutaneous injection techniques, and meticulously document the administration process and the animal's response. Correct answer is D. Consult with the veterinarian to confirm the appropriateness of the subcutaneous route for this specific animal and condition. Ensure personal competency in subcutaneous injection techniques, and meticulously document the administration process and the animal's response. Explanation. Scenario analysis. This scenario presents a common challenge in animal technology where a new, potentially more effective medication is introduced, but its administration requires a different route than the established protocol. The challenge lies in balancing the potential benefits of the new drug against the risks associated with altering a standard procedure, especially when the animal's welfare is paramount. The technician must consider not only the efficacy of the drug, but also the safety and stress involved in its administration, as well as the potential for errors. Correct approach analysis. The correct approach prioritizes the animal's welfare and adheres to the principle of providing the best possible care within the established regulatory framework. This involves a thorough understanding of the medication's pharmacology, including its absorption, distribution, metabolism, and excretion, as well as the specific risks and benefits of the proposed administration route. Consulting with the veterinarian to confirm the appropriateness of the new route, ensuring proper training and competency in the new technique, and meticulously documenting the process are all critical steps that align with professional standards and ethical obligations under the Diploma of Animal Technology's regulatory guidelines. This approach ensures that any deviation from standard practice is justified, safe, and well documented, minimizing risk to the animal and upholding professional accountability. Incorrect approach is analysis. An approach that immediately adopts the new medication and administration route without veterinary consultation or assessment of the technician's competency is professionally unacceptable. This fails to uphold the duty of care owed to the animal and bypasses essential safety checks. It could lead to improper drug delivery, reduced efficacy, or adverse reactions, all of which are regulatory and ethical failures. Furthermore, it demonstrates a lack of professional judgment and a disregard for established protocols designed to protect animal welfare. An approach that dismisses the new medication solely because it requires a different administration route, without considering its potential benefits or consulting with the veterinarian, is also professionally flawed. This can lead to suboptimal treatment for the animal, potentially prolonging suffering or hindering recovery. It represents a failure to stay abreast of advancements in veterinary medicine and a lack of proactive engagement in providing the best available care, which can be seen as a breach of professional responsibility. An approach that attempts to administer the new medication via the old route, despite knowing it is not the intended or recommended method, is a severe regulatory and ethical failure. This demonstrates a deliberate disregard for the drug's pharmacological properties and administration guidelines, directly endangering the animal's health and welfare. It constitutes a failure to follow instructions, a lack of understanding of basic pharmacology, and a serious breach of professional conduct. Professional reasoning. Professionals in animal technology must adopt a systematic decision-making process when faced with new medications or administration methods. This process should begin with understanding the rationale behind the change, consulting with the veterinarian to confirm its appropriateness and safety, assessing personal competency in the new procedure, and meticulously documenting all actions. This framework ensures that decisions are evidence-based, animal-centric, and compliant with all relevant regulations and ethical guidelines. Question 12. The risk matrix shows a moderate likelihood of respiratory distress and a high likelihood of gastrointestinal upset in a group of young pigs recently introduced to a new facility. One pig is observed to be lethargic, has a nasal discharge, and is exhibiting shallow breathing. Another pig in the same pen is showing signs of diarrhea and appears dehydrated. A third pig is coughing intermittently, but otherwise appears alert and is eating. Considering these observations and the information from the risk matrix, which of the following diagnostic approaches is most appropriate for determining the underlying cause of illness in this group of pigs? Option A. Administer broad-spectrum antibiotics to all pigs exhibiting any signs of illness, assuming a bacterial infection is the primary cause, and monitor for improvement. Option B. Isolate the coughing pig and administer a cough suppressant, while treating the pig with nasal discharge and shallow breathing with supportive care for respiratory symptoms, without further diagnostic testing. Option C. Focus diagnostic efforts solely on the pig with diarrhea, as gastrointestinal upset is indicated as a high likelihood on the risk matrix, and assume the other signs are secondary or unrelated. Option D. Conduct a thorough physical examination on all affected pigs. Collect fecal samples for parasitological and bacteriological examination, and obtain nasal swabs for viral and bacterial culture, while also considering the possibility of environmental stressors contributing to the observed signs. The correct answer is D. Conduct a thorough physical examination on all affected pigs. Collect fecal samples for parasitological and bacteriological examination, and obtain nasal swabs for viral and bacterial culture, while also considering the possibility of environmental stressors contributing to the observed signs. Explanation. This scenario presents a professional challenge due to the subtle and potentially overlapping clinical signs of different diseases in a herd of animals. Differentiating between conditions with similar initial presentations requires a thorough understanding of disease pathology, diagnostic principles, and the ability to interpret a range of clinical data. The technician's role is critical in observing, recording, and communicating these signs accurately to facilitate timely and appropriate diagnosis and treatment, thereby minimizing animal suffering and economic loss. The challenge lies in moving beyond superficial observation to a reasoned diagnostic approach. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic process. This involves a comprehensive assessment of the animal's history, a detailed physical examination, and the judicious selection of diagnostic tests. This methodical approach aligns with the principles of good animal husbandry and veterinary care, aiming to identify the root cause of the illness rather than just treating symptoms. It also reflects the ethical obligation to provide appropriate care and to act in the best interests of the animals, as mandated by professional codes of conduct and relevant animal welfare legislation. An incorrect approach that focuses solely on the most obvious symptom without considering other possibilities or conducting further investigation is professionally unacceptable. This could lead to misdiagnosis, delayed treatment, and potentially the spread of disease within the herd. Ethically, it fails to meet the standard of care expected of a competent animal health professional. Regulatory failures would arise if such an approach led to noncompliance with disease reporting requirements or animal welfare standards. Another incorrect approach that relies on anecdotal evidence or the opinion of untrained individuals is also professionally unsound. This bypasses established diagnostic protocols and can introduce bias and misinformation, compromising the integrity of the diagnostic process. It disregards the need for scientific validation and professional expertise, potentially leading to incorrect diagnoses and inappropriate interventions. The professional reasoning process for similar situations should involve a structured approach. 1. Gather comprehensive history. Understand the animal's background, environment, diet, and any recent changes. 2. Perform a thorough physical examination. Systematically assess all body systems, noting any abnormalities. 3. Formulate differential diagnoses. Based on the history and physical findings, list potential diseases that could explain the observed signs. 4. Prioritize differentials. Rank the potential diagnoses based on likelihood and severity. 5. Select appropriate diagnostic tests. Choose tests that will help confirm or rule out the most likely differentials. 6. Interpret results and confirm diagnosis. Integrate all available information to reach a definitive diagnosis. 7. Implement treatment and monitor response. Develop and execute a treatment plan and observe the animal's progress. 8. Communicate effectively. Maintain clear and concise communication with veterinarians and other relevant parties. Question 13. Operational review demonstrates that a standard enrichment item for a specific group of laboratory rodents has been temporarily unavailable due to supply chain issues. The proposed solution is to remove this enrichment from their housing for the next 2 weeks until the supply is restored. What is the most appropriate course of action? Option A. Inform the research team that the enrichment will be unavailable and proceed with its removal without further action. Option B. Introduce a novel, unvalidated enrichment item that is readily available to maintain some form of stimulation. Option C. Implement the proposed removal of the enrichment item immediately to avoid disruption to the daily husbandry schedule. Option D. Consult with the facility veterinarian or animal welfare officer to assess the impact and explore alternative enrichment strategies. The correct answer is D. Consult with the facility veterinarian or animal welfare officer to assess the impact and explore alternative enrichment strategies. Explanation. Scenario analysis. This scenario presents a common challenge in animal technology where a seemingly minor change in routine could have significant implications for animal welfare. The challenge lies in balancing operational efficiency with the ethical and regulatory obligations to provide adequate enrichment. A technician must critically evaluate the proposed change, considering its potential impact on the animal's psychological and physical well-being, and make a decision that upholds the highest standards of care. This requires a deep understanding of animal behavior, welfare science, and the relevant regulatory framework. Correct approach analysis. The correct approach prioritizes the animal's welfare by seeking expert consultation and conducting a thorough risk assessment before implementing any changes. This aligns with the principles of the Animal Welfare Act, or equivalent legislation in the specified jurisdiction, e.g., the Animal Scientific Procedures Act 1986 in the UK, or relevant state/territory legislation in Australia, which mandates that animals must be provided with appropriate care and accommodation, including environmental enrichment. Consulting with a veterinarian or a qualified animal welfare officer ensures that the decision is informed by expertise and adheres to best practices and legal requirements. This proactive approach demonstrates a commitment to preventing potential harm and ensuring that enrichment remains effective and appropriate for the species and individuals. Incorrect approaches analysis. Implementing the change without further investigation fails to acknowledge the potential negative impacts on animal welfare. This approach disregards the importance of enrichment as a fundamental aspect of animal care and could lead to behavioral abnormalities, stress, and reduced well-being, potentially violating the duty of care outlined in animal welfare legislation. Proposing an alternative enrichment that is not species-appropriate or has not been validated for effectiveness is also problematic. While the intention might be to maintain some form of enrichment, an unverified or unsuitable alternative could be ineffective or even detrimental, failing to meet the welfare needs of the animals and contravening the spirit and letter of animal welfare regulations that require appropriate enrichment. Ignoring the observation and proceeding with the original plan is the most egregious failure. This demonstrates a lack of professional responsibility and a disregard for animal welfare. It suggests a prioritization of operational convenience over the ethical and legal obligations to ensure the animal's well-being, which would be a clear breach of animal welfare legislation and professional codes of conduct. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with observation and data gathering. When a potential welfare concern or a change impacting welfare is identified, the next step is to consult relevant expertise, e.g., veterinarian, welfare officer. This is followed by a risk assessment to understand the potential consequences of different actions. Based on this assessment and expert advice, a decision is made that prioritizes animal welfare, ensuring compliance with all applicable regulations and ethical guidelines. Documentation of the process and the rationale behind the decision is crucial for accountability and continuous improvement. Question 14. Quality control measures reveal that a batch of animal feed has been inadvertently mixed with an unapproved vitamin supplement. What is the most appropriate immediate course of action? Option A. Immediately isolate the affected feed batch and initiate a formal investigation into the source and nature of the unapproved supplement. Option B. Discard the entire feed batch to eliminate any risk and then report the incident. Option C. Continue to use the feed batch while a preliminary investigation is conducted to assess the potential impact. Option D. Report the discovery to a supervisor and await further instructions before taking any action regarding the feed batch. The correct answer is A. Immediately isolate the affected feed batch and initiate a formal investigation into the source and nature of the unapproved supplement. Explanation. Scenario analysis. This scenario presents a professional challenge because the discovery of an unapproved additive in animal feed requires immediate and decisive action to protect animal welfare, public health, and the reputation of the facility. The technician must balance the need for swift resolution with adherence to established protocols and regulatory requirements. The challenge lies in identifying the root cause, assessing the immediate risk, and implementing corrective actions that are both effective and compliant. The presence of an unapproved additive raises concerns about efficacy, safety, and potential contamination, necessitating a thorough investigation. Correct approach analysis. The correct approach involves immediately isolating the affected feed batch and initiating a formal investigation. This aligns with best professional practice by prioritizing animal safety and preventing further exposure to a potentially harmful or ineffective substance. Isolating the feed batch is a critical first step in containment, preventing wider distribution and consumption. Initiating a formal investigation ensures that the source of the additive is identified, its potential impact is assessed, and appropriate corrective and preventative actions, CAPA, are implemented. This systematic approach is often mandated by regulatory frameworks governing animal health and food safety, ensuring accountability and continuous improvement. Ethically, it demonstrates a commitment to the welfare of the animals under care. Incorrect approaches analysis. Continuing to use the feed batch while investigating is a significant regulatory and ethical failure. It directly contravenes the principle of do no harm and exposes animals to an unknown substance, potentially leading to adverse health effects or compromising the integrity of research data. This approach disregards the precautionary principle, which dictates taking preventative action in the face of uncertainty. Discarding the feed batch without investigation is also problematic, though less immediately harmful than continued use. While it removes the immediate risk, it fails to address the systemic issue that allowed the unapproved additive to enter the supply chain. This represents a failure in due diligence and a missed opportunity for process improvement, potentially leading to recurrence. It also represents a potential waste of resources without understanding the cause. Reporting the issue to a supervisor but taking no immediate action to isolate the feed batch is a partial failure. While reporting is crucial, failing to take immediate containment measures allows the risk to persist. This approach demonstrates a lack of proactive problem solving and could be seen as a dereliction of immediate responsibility for animal welfare and biosecurity. Professional reasoning. Professionals in animal technology must adopt a risk-based approach. When a potential issue like an unapproved additive is identified, the immediate priority is to mitigate risk. This involves containment, followed by thorough investigation to understand the cause and prevent recurrence. Adherence to standard operating procedures, SOP, and regulatory guidelines is paramount. Professionals should always err on the side of caution when animal welfare or public health is at stake. A systematic approach involving documentation, investigation, and corrective action, ensures compliance and upholds ethical standards. Question 15. Assessment of a tissue sample from a laboratory animal reveals cells arranged in sheets, some with a luminal surface, and a significant amount of extracellular matrix containing collagen fibers and scattered fibroblasts. Additionally, elongated cells with striations are observed, along with cells possessing a large nucleus and cytoplasmic extensions. Based on these observations, which of the following represents the most accurate and comprehensive identification of the primary tissue types present and their primary functions within this sample? Option A. Epithelial tissue protection secretion, connective tissue support binding, muscle tissue contraction, nervous tissue signal transmission. Option B. Epithelial tissue contraction, connective tissue secretion, muscle tissue support, nervous tissue binding. Option C. Epithelial tissue signal transmission, connective tissue protection, muscle tissue secretion, nervous tissue support. Option D. Epithelial tissue storage, connective tissue transport, muscle tissue insulation, nervous tissue protection. The correct answer is A. Epithelial tissue protection secretion, connective tissue support binding, muscle tissue contraction, nervous tissue signal transmission. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the accurate identification and functional understanding of different tissue types within a biological sample. Misidentification can lead to incorrect diagnoses, inappropriate treatment plans, and potentially compromise animal welfare. The technician must apply their knowledge of histology and physiology to a practical situation, demonstrating precision and attention to detail. Correct approach analysis. The correct approach involves systematically examining the cellular morphology and arrangement to identify the characteristic features of each tissue type. Epithelial tissue is identified by its closely packed cells forming continuous sheets, often with distinct apical and basal surfaces, and its primary functions of protection, secretion, and absorption. Connective tissue is recognized by its scattered cells within an extracellular matrix, which can vary in consistency, e.g., bone, cartilage, blood, adipose, and its functions of support, binding, insulation, and transport. Muscle tissue is characterized by elongated cells, fibers, capable of contraction, with distinct types skeletal, smooth, cardiac, exhibiting different structural features. Nervous tissue is identified by neurons with their characteristic cell bodies and extensions, axons and dendrites, and glial cells, responsible for transmitting electrical and chemical signals. This systematic identification ensures accurate assessment of the sample's composition and the integrity of its various components, directly impacting the quality of diagnostic information. Incorrect approach is analysis. One incorrect approach would be to focus solely on the most abundant tissue type present, ignoring the presence and function of other, less prevalent but equally important, tissues. This fails to provide a comprehensive assessment and could miss critical pathological changes in minority tissue populations, potentially violating ethical obligations to provide thorough diagnostic services. Another incorrect approach would be to assume all tissues with similar cellular shapes are the same type, without considering their arrangement, extracellular matrix, or functional specializations. This oversimplification can lead to misclassification, such as confusing a dense connective tissue with a type of epithelial lining, which would result in an inaccurate understanding of the sample's structure and function, and could lead to incorrect conclusions about disease processes. A third incorrect approach would be to prioritize visual aesthetics over accurate histological identification, focusing on staining intensity or cellular appearance, without correlating these with established tissue characteristics and functions. This subjective approach is not grounded in scientific principles and would compromise the reliability of the diagnostic findings, failing to meet professional standards for accuracy and objectivity. Professional reasoning. Professionals should approach tissue identification by first understanding the overall context of the sample and the purpose of the examination. They should then systematically observe the sample under magnification, looking for key morphological features that define each of the four primary tissue types: epithelial, connective, muscle, and nervous. This involves considering cell shape, arrangement, the presence and nature of the extracellular matrix, and any specialized structures. Comparing these observations against established histological criteria is crucial. If uncertainty exists, consulting reference materials or seeking a second opinion from a more experienced colleague or supervisor is a vital step in ensuring accuracy and upholding professional responsibility. This methodical and evidence-based approach ensures that diagnostic information is reliable and contributes to appropriate animal care. Question 16. Comparative studies suggest that a veterinary nurse's proficiency in understanding and applying common veterinary terminology directly impacts the accuracy of patient care. A veterinarian describes a canine patient presenting with a sudden onset of severe, involuntary muscle contractions and a rapid heart rate. The nurse is asked to prepare the necessary equipment for immediate intervention. Which of the following interpretations of the veterinarian's description best reflects a precise understanding of the presented clinical signs? Option A. The patient is suffering from anorexia, meaning a loss of appetite. Option B. The patient is showing symptoms of polyuria, which is an increased frequency of urination. Option C. The patient is experiencing a seizure, characterized by abnormal electrical activity in the brain, leading to temporary changes in behavior, motor control, or consciousness. Option D. The patient is exhibiting signs of dyspnea, indicating difficulty in breathing. The correct answer is C. The patient is experiencing a seizure, characterized by abnormal electrical activity in the brain, leading to temporary changes in behavior, motor control, or consciousness. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary technology, where accurate interpretation of medical terminology is crucial for effective patient care and communication within the veterinary team. Misunderstanding or misusing terms can lead to incorrect treatment plans, medication errors, and compromised animal welfare. The professional challenge lies in ensuring that the veterinary nurse possesses a robust understanding of these terms to accurately relay information, document findings, and execute procedures as directed by the veterinarian. Correct approach analysis. The correct approach demonstrates a thorough understanding of the specific veterinary term and its precise meaning within the context of animal health. This ensures accurate communication with the veterinarian, correct administration of treatments, and proper record keeping, all of which are fundamental to providing high-quality animal care and adhering to professional standards expected of a Diploma of Animal Technology graduate. This aligns with the implicit regulatory expectation of competence in core veterinary knowledge. Incorrect approaches analysis. An incorrect approach, such as confusing a term with a similar sounding but distinct one, represents a failure in fundamental knowledge. This can lead to the administration of incorrect medications or treatments, directly impacting animal welfare and potentially violating the duty of care expected under general animal welfare legislation and professional conduct guidelines. Another incorrect approach might involve a superficial understanding, leading to an inability to differentiate between related conditions or symptoms, hindering accurate diagnosis and treatment planning, which is a failure to meet the expected standard of professional practice. A third incorrect approach could involve applying a term in a context where it is not applicable, demonstrating a lack of nuanced understanding and potentially leading to miscommunication and inappropriate actions. Professional reasoning. Professionals should approach such situations by first ensuring they have a clear and precise definition of the term in question. If unsure, they should consult reliable veterinary resources, such as textbooks, reputable online databases, or seek clarification from a supervising veterinarian. The decision-making process involves cross-referencing the term with the clinical signs observed, the proposed treatment, and the patient's history to ensure accurate application and communication. This methodical approach minimizes the risk of error and upholds professional accountability. Question 17. Process analysis reveals that a veterinary diagnostic laboratory is examining blood smears from various animal species. A technician observes cells with distinct nuclear shapes and cytoplasmic inclusions to accurately identify potential abnormalities indicative of disease, which comparative analysis of cellular structure and function is most critical for reliable interpretation. Option A. Applying generalized knowledge of mammalian cell structures to all observed cells, assuming significant similarities across all animal species regardless of their evolutionary lineage or physiological adaptations. Option B. Focusing solely on the most prominent cellular features, such as the overall cell size and shape, without detailed examination of internal structures or species-specific variations. Option C. Interpreting cellular structures based on the assumption that any deviation from a generic textbook example of a cell indicates a pathological condition, irrespective of species or context. Option D. comparing the observed nuclear morphology and cytoplasmic inclusions against established normal parameters for the specific animal species and tissue type, considering known variations in cellular function across species. The correct answer is D. Comparing the observed nuclear morphology and cytoplasmic inclusions against established normal parameters for the specific animal species and tissue type, considering known variations in cellular function across species. Explanation. Scenario analysis. This scenario presents a professional challenge in a diagnostic setting where accurate identification of cellular abnormalities is crucial for animal health outcomes. The technician must apply their knowledge of animal cell structure and function to interpret microscopic findings, distinguishing between normal cellular morphology and signs of disease or stress. This requires meticulous observation, a strong understanding of comparative cell biology across different animal species, and the ability to relate structural differences to functional implications. The challenge lies in the potential for subtle variations to be indicative of significant pathology, demanding a high degree of precision and adherence to established diagnostic protocols. Correct approach analysis. The correct approach involves a systematic comparison of the observed cellular structures against known normal parameters for the specific animal species and tissue type. This aligns with best professional practice by ensuring that any deviations are identified in the context of species-specific physiology and potential pathological changes. Regulatory frameworks governing animal health diagnostics, such as those overseen by the insert-relevant Australian regulatory body, e.g., APMA or state-based agricultural departments, emphasize accuracy and reliability in diagnostic procedures. Ethically, this approach prioritizes the welfare of the animal by facilitating timely and appropriate treatment based on accurate diagnosis. It demonstrates a commitment to evidence-based practice, a core tenet of animal technology. Incorrect approach is analysis. One incorrect approach would be to rely solely on generalized knowledge of mammalian cell structures without considering species-specific variations. This fails to meet professional standards because different animal species exhibit unique cellular characteristics due to evolutionary adaptations and physiological differences. For example, erythrocyte morphology can vary significantly between species. Such an approach could lead to misinterpretation of normal findings as pathological, resulting in unnecessary stress or inappropriate treatment for the animal, and potentially contravening animal welfare regulations. Another incorrect approach would be to focus only on the most prominent cellular features, neglecting subtle but diagnostically significant details. This is professionally unacceptable as many diseases manifest through subtle alterations in organelle function or membrane integrity, which may not be immediately obvious. Overlooking these details could lead to a misdiagnosis, delaying crucial intervention, and potentially worsening the animal's prognosis. This directly impacts the quality of care and could be considered a breach of professional duty of care, which is implicitly or explicitly covered by professional conduct guidelines. A further incorrect approach would be to assume that cellular structures observed under suboptimal microscopic conditions, e.g., poor staining, inadequate magnification, are representative of the true cellular state. This is a failure in adherence to established laboratory protocols and quality control measures, which are often mandated by regulatory bodies to ensure diagnostic accuracy. Compromising on observational quality directly undermines the reliability of any subsequent interpretation, leading to potentially erroneous conclusions and negatively impacting animal health management. Professional reasoning. Professionals should adopt a decision-making process that prioritizes accuracy, species specificity, and adherence to established protocols. This involves 1. Thoroughly understanding the normal cellular morphology for the specific species and tissue being examined. 2. Employing appropriate sample preparation and microscopy techniques to ensure optimal visualization. 3. Systematically evaluating all cellular components, paying attention to both gross and subtle features. 4. Consulting relevant diagnostic guides or experienced colleagues when encountering ambiguous findings. 5. Documenting all observations and interpretations meticulously. This systematic and evidence-based approach ensures that diagnostic conclusions are robust and contribute to effective animal care, aligning with professional responsibilities and regulatory expectations. Question 18. To address the challenge of providing appropriate care and handling for a diverse range of animals in a research or veterinary setting, which approach best demonstrates an understanding of comparative anatomy across mammals, birds, reptiles, and amphibians. Option A. Systematically evaluating and applying species-specific anatomical and physiological knowledge for each animal group, recognizing significant internal and external variations. Option B. Assuming that anatomical structures and physiological functions are largely interchangeable across all vertebrate classes, with only superficial differences. Option C. Focusing solely on external morphology and common behaviors, as internal anatomical differences are unlikely to impact routine care protocols. Option D. Prioritizing a generalized mammalian anatomical model as the baseline for all species, making minor adjustments for obvious external differences. The correct answer is D. Prioritizing a generalized mammalian anatomical model as the baseline for all species, making minor adjustments for obvious external differences. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in physiological responses and anatomical structures across different animal species. A technician must apply their knowledge of comparative anatomy to ensure appropriate care and handling, which directly impacts animal welfare and the validity of research or diagnostic procedures. Misinterpreting anatomical differences can lead to incorrect assessments, inappropriate interventions, and potential harm to the animals, violating ethical principles and potentially regulatory requirements for animal welfare. The challenge lies in moving beyond generalized knowledge to species-specific application, requiring critical thinking and a thorough understanding of the nuances of each animal group. Correct approach analysis. The correct approach involves a systematic evaluation of the specific anatomical and physiological characteristics of each species being handled. This aligns with best professional practice by prioritizing species-specific needs and ensuring accurate data collection or care. For example, understanding the avian respiratory system's unique air sac structure, the reptilian ectothermy and different metabolic rates, the amphibian permeable skin, and the mammalian diverse organ systems is crucial for appropriate housing, feeding, restraint, and sample collection. This approach is underpinned by ethical obligations to provide species-appropriate care and by regulatory frameworks that mandate such considerations for animal welfare and research integrity. Incorrect approaches analysis. Applying a generalized mammalian approach to all species is a significant regulatory and ethical failure. Mammals have distinct physiological systems, e.g., diaphragm for respiration, endothermy, that differ markedly from birds' air sacs, endothermy but different thermoregulation, reptiles' ectothermy, varied respiratory mechanisms, and amphibians, cutaneous respiration, ectothermy. This failure would violate regulations requiring species-appropriate care and could lead to misdiagnosis, ineffective treatment, or stress and injury due to improper handling or environmental conditions. Assuming all non-mammalian vertebrates share identical anatomical features is another critical failure. For instance, treating a bird's gastrointestinal tract as equivalent to a reptile's would ignore differences in digestion rates, organ placement, and potential for impaction. Similarly, overlooking the permeable skin of amphibians when considering environmental conditions or medication administration would be a direct contravention of welfare standards and could lead to toxicity or dehydration. These assumptions demonstrate a lack of due diligence and a failure to adhere to the principle of providing species-specific care, which is a cornerstone of ethical animal handling and regulatory compliance. Professional reasoning. Professionals should adopt a decision-making process that begins with identifying the species in question. Subsequently, they must access and apply specific knowledge regarding that species' comparative anatomy, physiology, and ethology. This involves consulting reliable resources, seeking guidance from experienced colleagues or supervisors, and continuously updating their knowledge base. When faced with uncertainty, the professional's primary responsibility is to err on the side of caution, prioritizing animal welfare and seeking clarification before proceeding with any procedure or care plan. This iterative process of identification, knowledge retrieval, application, and verification ensures adherence to both ethical standards and regulatory requirements. Question 19. The control framework reveals that a technician is caring for a rabbit exhibiting signs of gastrointestinal stasis, including lethargy and reduced fecal output. The rabbit is currently on a diet primarily consisting of hay and a small amount of commercial pellets. The technician recalls that rabbits are herbivores with a specialized digestive system adapted for processing fibrous plant material. Considering the potential causes and the rabbit's dietary needs, what is the most appropriate immediate course of action? Option A. Immediately contact the veterinarian to report the symptoms and discuss the rabbit's diet and condition. Option B. Administer a laxative to encourage bowel movement, as this is a common treatment for stasis. Option C. Increase the amount of commercial pellets offered, as these are often formulated to provide balanced nutrition. Option D. Offer a small amount of high-sugar fruit, as this can sometimes stimulate appetite and gut motility. The correct answer is C. Increase the amount of commercial pellets offered, as these are often formulated to provide balanced nutrition. Explanation. This scenario presents a professionally challenging situation because it requires balancing the immediate welfare of an animal with the long-term implications of dietary management, all within the context of established veterinary protocols and ethical considerations. The technician must apply their knowledge of digestive physiology to a real-world problem, recognizing that different species have distinct nutritional requirements and digestive adaptations. The challenge lies in interpreting the observed symptoms and formulating a response that is both scientifically sound and ethically responsible, avoiding assumptions and seeking appropriate guidance. The correct approach represents best professional practice because it prioritizes animal welfare and adheres to the principle of seeking expert veterinary advice when faced with uncertainty or complex cases. This aligns with the regulatory framework's emphasis on responsible animal care and the technician's role in supporting veterinary decision-making. By consulting the veterinarian, the technician ensures that any dietary adjustments are made based on a comprehensive diagnosis and a thorough understanding of the animal's specific needs, minimizing the risk of harm. This collaborative approach is fundamental to ethical veterinary practice and regulatory compliance. An incorrect approach that involves immediately changing the diet without veterinary consultation represents a significant regulatory and ethical failure. This bypasses the veterinarian's diagnostic authority and could lead to inappropriate dietary changes that exacerbate the animal's condition or create new health problems. It violates the principle of acting within one's scope of practice and demonstrates a lack of professional judgment. Another incorrect approach, such as ignoring the symptoms and continuing with the current feeding regimen, constitutes a failure to act in the animal's best interest and a potential breach of duty of care. This inaction could lead to the animal's suffering and a worsening of its condition, which is ethically unacceptable and may contravene animal welfare legislation. Professionals should employ a decision-making framework that begins with careful observation and data gathering. This includes noting the specific symptoms, the animal species, age, and current diet. The next step is to assess whether the situation falls within their scope of practice and requires veterinary intervention. In cases of digestive upset or uncertainty about dietary needs, consulting the veterinarian is paramount. This involves clearly communicating observations and concerns to the veterinarian, allowing them to make an informed diagnosis and treatment plan. Professionals should always prioritize the animal's welfare and seek guidance when necessary, rather than making assumptions or acting unilaterally. Question 20. The risk matrix shows a moderate likelihood of a novel respiratory illness in a group of imported exotic birds, with a high potential impact on both avian and human health due to suspected zoonotic properties. As an animal technologist working in a quarantine facility, what is the most appropriate immediate course of action? Option A. Inform the facility manager of the potential risk and request that the birds be released from quarantine to prevent further spread within the facility. Option B. Continue routine observation and document the symptoms, awaiting further development before escalating to veterinary involvement. Option C. Immediately isolate the affected birds and contact the designated veterinarian for assessment and guidance on diagnostic testing and biosecurity protocols. Option D. Administer broad-spectrum antibiotics to the entire group of birds as a precautionary measure. The correct answer is C. Immediately isolate the affected birds and contact the designated veterinarian for assessment and guidance on diagnostic testing and biosecurity protocols. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal technologist to balance immediate client needs with the overarching responsibility for animal welfare and public health, as dictated by the regulatory framework for animal technology. The potential for zoonotic disease transmission adds a layer of complexity, necessitating adherence to strict biosecurity protocols and accurate reporting. Misidentification of a disease or an inappropriate response can have significant consequences for the individual animal, other animals in the facility, and potentially human health, all of which are areas governed by specific regulations and ethical guidelines. Correct approach analysis. The correct approach represents best professional practice because it prioritizes accurate diagnosis and appropriate management in accordance with established veterinary protocols and regulatory requirements. This involves consulting with a veterinarian who is legally empowered to diagnose and prescribe treatment, ensuring that the animal receives care that is both medically sound and compliant with animal welfare legislation. Furthermore, reporting suspected zoonotic diseases is a legal obligation under public health regulations, protecting the wider community. This approach demonstrates adherence to the principles of responsible animal care, professional conduct, and public safety, all of which are fundamental to the Diploma of Animal Technology's regulatory framework. Incorrect approaches analysis. An incorrect approach that involves attempting to diagnose and treat the condition without veterinary consultation is a significant regulatory and ethical failure. This bypasses the legal requirement for veterinary oversight in diagnosis and treatment, potentially leading to incorrect management, animal suffering, and delayed or ineffective treatment. It also fails to address the potential public health risk if the disease is zoonotic. Another incorrect approach, such as ignoring the symptoms or downplaying their significance, constitutes a failure in professional duty of care and animal welfare. This neglects the responsibility to identify and address potential health issues, which can lead to the deterioration of the animal's condition and the spread of disease. It also violates ethical obligations to act in the best interest of the animal. Finally, an approach that involves self-prescribing or administering over-the-counter medications without veterinary guidance is also professionally unacceptable. This can lead to adverse drug reactions, mask symptoms, or be ineffective against the actual disease, all of which are detrimental to the animal's health and contravene regulations regarding medication administration. Professional reasoning. Professionals in animal technology must adopt a systematic decision-making process. This begins with thorough observation and data collection regarding the animal's condition. The next critical step is to assess the potential risks, including the severity of symptoms, the possibility of contagion, and the potential for zoonotic transmission. Based on this assessment, the professional must determine if veterinary consultation is required, which is almost always the case for new or concerning symptoms. Adherence to reporting protocols for suspected zoonotic diseases is paramount. Professionals should always operate within their scope of practice, recognizing the boundaries and seeking appropriate expertise when necessary, thereby ensuring compliance with all relevant legislation and ethical standards.